Thank you all for joining us tonight for the role of the specialty pharmacy as part of your healthcare team. This webinar series is brought to you by Can Do Multiple Sclerosis. My name is Laura Allen, and I'm the Director of Programs at Can Do MS. I'd like to thank the sponsor of this webinar, CenterWell Specialty Pharmacy. So tonight I have the pleasure of introducing our speakers. Our moderator this evening is Kathy Costello. Hello, Kathy. Kathy is a nurse practitioner and Chief Operating Officer at Can Do MS. Also joining us from CenterWell Specialty Pharmacy is Megan Weinbrenner, the Clinical Pharmacy Lead, and Courtney Tyus, the Patient Financial Services Team Lead. In addition, we have Kathy Chester. Kathy is a person living with MS and the host of MS Disruptive. So welcome to our panel. And as I mentioned, this is going to be a three-part webinar. Part number one, we'll be talking about the overview of specialty pharmacies. Part two will focus on the emotional support services that a specialty pharmacy can provide. And finally, part three will focus on the financial resources that a specialty pharmacy can provide. And as I mentioned, we will answer a few questions after each part. So please use the Q&A feature to ask your questions. And with that, I am going to turn the meeting over to Kathy Costello.
Thanks so much, Laura. And let me just welcome everybody. It's so nice to have you here with us. I'd also like to welcome our panel. We're very fortunate tonight to have the expertise that we do on the panel, not just about specialty pharmacies and how we use them, but also specifically about CenterWell, which is an added feature to actually learn what a specific specialty pharmacy has to offer people with MS. So our objectives tonight are to understand the difference between a neighborhood pharmacy and a specialty pharmacy, to understand the role of the specialty pharmacy and pharmacist in MS care, and also be familiar with some of those benefits that a specialty pharmacy can provide that are different from other pharmacies. And we have a polling question. We often start our webinars this way, but this is just to kind of see where people are. So our question is, do you currently have, here we go, a relationship with a specialty pharmacy? Okay, so actually quite a few people, and interestingly enough, quite a few that aren't quite sure. And that's honestly perfect, because I think that there's going to be something for everyone this evening. And I think for some, as we're seeing, this may be the first time you've even heard about a specialty pharmacy and any details about a pharmacy. And tonight, as I mentioned, we're also going to hear about a specific pharmacy. And I just want to let you know that all of our webinars are for informational purposes, and we don't endorse any specific product or organization or company. However, we do believe that having this information is important for you when you're making decisions about your care. And you need to know where the information is available to you so that you can identify it and find it as you're making those decisions. And I'm sure tonight during our webinar, there's going to be lots of questions, and we are going to try our best to get to as many as we can. Unfortunately, we can't answer any specific questions about your specific treatment, but we can answer questions in general about the role of the specialty pharmacist, how they handle these medications, and what they have to offer for you. As Laura mentioned, we are separating this into three segments. For you, our live listeners tonight, it is one webinar, but we're going to archive this in three different segments. So you're going to hear me throughout, and Laura as well, throughout this webinar, saying that closes segment one. For section one, or segment one, we're going to talk now about an overview of specialty pharmacies, what they are, what they offer to people living with MS, and then we'll also include some specifics about CenterWell Specialty Pharmacy. And so I'm going to dive right in to Megan Weinbrenner, who is a pharmacist at CenterWell and actually the lead there. And I think we need your help in helping us figure out what are specialty pharmacies, what are the services that they have, and what do they offer specifically people living with MS.
Absolutely. So a specialty pharmacy really is going to differ from a traditional pharmacy in the sense that specialty pharmacy will dispense specialty medications. So you're probably wondering, what is a specialty medication, right? Well, there's a number of factors that can determine if a medication is specialty. And so examples of some of those are going to be, maybe the way the medication is administered, the side effects associated with the medication, sometimes the management of those side effects, the cost of the side effect or the cost of the medication, even certain access requirements set forth by the manufacturer. So a lot of times within the specialty pharmacy, we are dispensing those specialty medications, but we're also providing patient support, because patients who are filling a specialty pharmacy often require more support because they're dealing with complex chronic health conditions.
Thanks for that, Megan. So obviously tonight we're talking specifically about MS, but family members might be listening in too. So what are those other conditions or diseases where you would likely see the utility for a specialty pharmacy?
Absolutely. So, I know we're talking about multiple sclerosis right now, but we do fill for multiple sclerosis prescriptions, oncology. A lot of times, some of the newer oncology medications are going to come through the specialty pharmacy. Sometimes we'll do things for other neuromuscular conditions, asthma we will offer, cystic fibrosis. There's a lot of medications in the pulmonary space. So there's a variety of disease states. Some of them are rare diseases. But there's a variety of medications, even sometimes rheumatoid arthritis, a lot of inflammatory autoimmune conditions. A lot of those medications in that space will be considered specialty.
I see. So it sounds to me these are the really more complex medications, special handling, and also diseases and conditions that are also complex. And so I think we're going to get into a little bit more of that in a bit, but I think that helps clear it up a little bit. And now I mentioned that you are a clinical pharmacist, but you're also the pharmacy lead at CenterWell. And so can you tell us just a little bit about what that means and what your role is?
Absolutely. So as a clinical pharmacy lead, I help facilitate with the development, implementation, and maintenance of clinical programs that we offer through the specialty pharmacy. So some of these clinical programs are often known as centers of excellence, and we have one of those here within as it relates to multiple sclerosis at CenterWell, which is the Neuromuscular Center of Excellence. Disease-specific clinical programs that really help to support patients through their treatment journeys and to really help to improve the patient outcomes.
Great, thank you. So we've talked a little bit about specialty pharmacy, but we really haven't differentiated it from the neighborhood pharmacy. For instance, for me, when I go to get the local pharmacy, the conversations I have center around how much do I owe? Although I do receive information, and I'm always asked if I have questions about the medication, but it's not so personal, right? There's a lot going on. It's really busy, and you're in, you're out, you've waited in line. And honestly, I don't ask questions. And, I often chalk that up that I'm a healthcare provider, but on the other hand, it's just more time, but maybe I should. So anyway, can you help us understand how these different pharmacies are different?
Yeah, so specialty pharmacy really offers personalized support and a lot of clinical programs for patients. So I mentioned earlier, we have clinical programs. So care often continues after the medication has been dispensed. We follow patients throughout their treatment journey, making sure that they're doing well on therapy, trying to remove any barriers that could potentially impact how a patient does. We have a team here that helps in all aspects of filling the prescription. So we have a team of technicians that really helps onboard the patient. We have a team of financial specialists that really help, and they're tasked at finding ways to reduce the cost of medications. We have a team of clinical team members. So we've got registered nurses, pharmacists. They really have clinical expertise in their space, and particularly within the neuromuscular space, we have clinical expertise with multiple sclerosis. We also have social workers as well. So we have a team here to support the patients throughout their treatment journey and to continue to follow them throughout their treatment.
Wow, that's very extensive. It sounds like you're able to provide quite a bit for people. And I saw you smile as you mentioned your team, and I know you're very proud of them and the work that they're doing.
Very much.
Sure.
Very much.
So as we know, people with MS are often on a lot of different medications, right? And Some for their symptoms. People may have other conditions, although that's totally unfair. People may also have other comorbid conditions that they're living with. So do they also get those medications from the specialty pharmacy?
So a patient that's being treated for multiple sclerosis is likely to be on a disease modifying therapy, so a DMT for short. Likely that'll come from a specialty pharmacy, as those are considered specialty. However, they can also be on other medications for symptom management, and some of which are going to be considered specialty, but then there are others that aren't. So it's likely that a patient would receive those specialty medications for their symptom management through the specialty pharmacy, but could use a traditional or maybe a retail pharmacy for those that aren't considered specialty.
I see. That makes sense. So even though they're not getting their symptomatic management or other disease condition medications from the specialty pharmacy, if they're on the phone with their specialty pharmacy, are they able to ask questions about their symptomatic medicines, or do they have to go back to where they got it from?
Absolutely. We're here to support the patient. We, don't want to make them make an extra phone call. So yes, we're happy to support them, even if it's a medication that we don't dispense. So we will help them when we can.
Oh, that's fantastic. I'm sure people would appreciate having a one-stop shop rather than trying to make a bunch of different phone calls to figure things out. So that's quite helpful. Yeah. So at what point in a person's MS care do they often get connected with a specialty pharmacy?
Sure. So the recommendation is to start a disease modifying therapy early on. So either when a patient has been diagnosed or with a clinically isolated syndrome. So it's likely that a patient would begin filling one of their DMTs, a DMT, through the specialty pharmacy early on. There's, always exceptions, but it's likely that they could be, getting that from a specialty pharmacy early on.
I see. Thank you for that. So I think we've gotten a good explanation of specialty pharmacies and essentially what they do and the services in general that they can provide and how they are different from the neighborhood pharmacy. But let's now turn to what you do, which is CenterWell Specialty Pharmacy. And let's just hear a little bit about what kinds of services you provide so that people can have an idea of what one specialty pharmacy provides for them.
Absolutely. So CenterWell Specialty Pharmacy was created specifically to help support patients taking high-cost specialty medication to really help with the financial and emotional burden associated with these complex conditions. So here at CenterWell Specialty Pharmacy, I mentioned earlier, we have a number of team members that really help in all aspects of filling the specialty prescription. We have technicians that really help to onboard the patient. We have financial specialists that help to find ways to reduce costs. We have pharmacists that are available 24/7 for counseling, clinical support on the medication, administration instructions, side effect counseling, drug interaction counseling. But then, as I mentioned earlier, we also have a number of clinical programs, one of which, as it relates to MS, is going to be our Neuromuscular Center of Excellence. So within our Neuromuscular Center of Excellence, we have a dedicated team. So this team is dedicated to those patients that are being treated for a neuromuscular condition and receiving a specialty prescription through CenterWell Specialty Pharmacy. Dedicated technicians to help onboard the patient, dedicated financial specialists who are really familiar with the funding in the MS space, dedicated nurses and pharmacists that have that clinical expertise in this space as well. And then we also have a social worker. Our social worker is really devoted to helping address the challenges that patients may face. And so really, what our goals at CenterWell Specialty is to offer holistic management. We realize that there's a number of factors that could contribute to why a patient maybe does or doesn't do well on therapy. And so we want to remove any barriers that could potentially get in the way of a patient doing well on therapy. So we really try to follow the patient throughout their treatment. And just kind of assess them for anything that may come up within the content of that calls.
Wow. Did I hear you say that your pharmacists are available 24/7? Did I hear that right?
You heard it. Yeah.
That's amazing. I mean, it takes away all the problems that we all have with, oh, wait, they're West Coast time, they're East Coast time. You don't have to worry about it. It's 24/7.
Yeah.
That's a very nice feature if people have questions or concerns. So that's awesome.
Absolutely.
So this has really been quite informative. And I will say that for anyone who has additional questions, they want to dig in more to this particular specialty pharmacy, we'll provide a link at the end of the presentation. And that way you'll be able to go ahead and go there and ask all the questions that you have. So I'd like now to turn to Kathy Chester, who has waited patiently here. And Kathy, I'm so happy that you're here with us because, you know, it's one thing for a provider or the pharmacy to talk about what we do, but it's another thing to hear from someone who actually has experience with utilizing a specialty pharmacy. So my first question for you is, my understanding is you didn't always use a specialty pharmacy. So can you tell me how you used your neighborhood pharmacy and then when you began to use the specialty pharmacy?
Sure. So like you, Kathy, it was just, you know, going to whatever was local, like your local CVS or Target or Walgreens, whatever was local. And then, you know, you felt like a number. It was just whatever they had, they gave it to you. They didn't know who you were, even though, as we know, with a autoimmune disease, you get several medications. So you feel like, gosh, I feel like you should know me. I'm here every day. But it was never like that. So then, you know, you find something that is a little bit smaller and you feel like they should know you a little bit more, and they do, but it's still not the same. They don't know your disease. They don't know what you have. And so I felt it was about a year and a half ago or so that I was introduced to specialty pharmacy. And that was so new to me and so different. I remember the first phone call that I got when they were helping me with a specific one for my migraines that have been very severe. And what I loved about it was it just wasn't that that my medicine was here, that they could send it to me, which I was like, wait, I don't have to stand in line. What? And also they cared. They wanted to make sure that this was correct. They were sending it to the correct address. But then after, they checked in on me to make sure that it was working. How did I feel? Did I feel that the migraines were settling down? So it was just such a different feeling than going in line and hoping that there weren't 50 people in back of me, that I wasn't holding up the line. But it was this feeling like, wait, is this too good to be true? You're asking me if my migraines have settled down? So it was just a very different feeling than it was going to your neighborhood pharmacy.
Tell me how that made you feel. I mean, what was it? You know, you get your medication from the neighborhood pharmacy, but what did it do for you in terms of how you felt about the disease, for instance, or that connection? How did it make you feel?
Like I had missed out on so much. Like what was I doing all this time? Just like someone cared and they understood, and it just felt so. And, you know, I am an overachiever. So with having not just the MS, but the epilepsy and the rheumatoid, it was like, wow, they understand it all. And they understand how it affects each disease. So maybe this one isn't the best one, but let's look into something else. Who gets that at different pharmacies, you know? So it was like such an added touch. It was like more than I had ever experienced. So I was so impressed right off the bat.
That's fantastic. So I guess then for you, I mean, it was a complete shift in how you were managing these different entities, your overachieving entities that you're living with, right?
Exactly.
Yeah. Yeah. So that's actually fantastic. And do you have the opportunity to make outreach to them as well as them making outreach to you most
I can for 100%. I can outreach to them at any point, but and I'll talk about this again later. Is what I loved is that they outreach to me. So when I need a refill and cognitively I may forget, they're always there to reach out to me, and which is so incredible because as we know with MS, there are things that we forget. And I may not remember, or they'll even ask, how did the medication, were you able to take it this month? How did you do with it? And I'll think, did I take it? And I'll look and say, you know what? I'm going to take it right now. So it's just that added benefit that you wouldn't get from a local pharmacy calling you and saying, did you take your medication? So
exactly.
That was just an added benefit again with having them ask me how I did. Did I take it? Am I out? Who does that? So this was all new to me and very, very personal and something I had never experienced before.
Yeah. Yeah, that's fantastic. So very high touch, very personal,
Yes.
very individualized. That's nice. Excellent. Megan, I'm going to turn back to you as we wrap up this first segment of our webinar. Is there any tip or suggestion that you want to provide to our audience who maybe is thinking about, or maybe now they have a prescription going to a specialty pharmacy for the first time?
Yeah, absolutely. So I think what I'd love to share is just that the specialty pharmacy really goes beyond just dispensing the specialty medication. We provide a lot of resources available, clinically, financially, emotionally. We really, try to take care of the patient holistically. And so there's a lot of resources available that we can share with the patient. And we just try to support you throughout, the entire journey.
Excellent. Thank you. Thank you, Laura. I'm going to bring you back up and see if we have any questions that have popped up in our chat.
Absolutely. This question we're going to direct to Megan. So who should a patient talk to, a pharmacist or a neurologist, about new drugs that become available?
We talk to both. So I think that pharmacists are, very knowledgeable. Obviously, I'm a pharmacist, so I'm, speaking with a lot of pharmacists daily, but pharmacists are knowledgeable on the medications that are available in the MS space, especially as it relates to some new drugs that are coming on the market, but neurologists as well too. So you definitely want to have both players and as part of your care team. So I think everyone brings value to the team, but I definitely would recommend speaking with both.
Wouldn't you say, Megan, that particularly when it comes to things like drug interactions and how the drugs interact with food and those kind of very specific pharmacy kinds of questions, that the pharmacist might be better equipped and experienced to answer something like that?
Yeah, I think that's a lot of times what pharmacists do on the daily basis is they're checking for drug interactions, making sure everything looks appropriate based on what the patient is taking, maybe for other disease states. So yeah, I think that's, typically what, the pharmacists are doing daily, and happy to support patients throughout.
Awesome. Anything else, Laura?
So I did want to ask, who decides if a patient should use a specialty pharmacy or not? How is that decision made?
So that could be, that's a tough question to answer. So a lot of times some specialty medications, I mentioned earlier, have certain access requirements set forth by the manufacturer. Those are known as limited distribution drugs. So sometimes the manufacturer can kind of decide who can dispense that medication. Sometimes insurance may play a part in that. So there's a number of factors as to why a patient may fill at certain locations versus others. So hard to answer just, with one straightforward answer there, but.
Absolutely understand. Kathy Chester, we did have somebody ask how long you've been diagnosed with MS. I think they want to put, you into perspective and the information that you're providing.
Well, I'm OG. I've been diagnosed. I've been now over 22 years. So.
Perfect. Thank you for that. And there was one other question. When you recently switched to a specialty pharmacy, is that correct?
Yes.
And how did the price compare when you used a specialty pharmacy versus a neighborhood pharmacy?
Same. There wasn't a difference in price.
Fantastic. So with that, I think we're going to conclude segment 1.